Our speakers today. Tracie Campbell is the Senior Health Manager for the Office of Violence Prevention with Mecklenburg County Public Health. She's responsible for promoting public health strategies to reduce violence throughout Mecklenburg County. In addition, she works as an adjunct instructor in the Department of Public Health at North Carolina Central University. She was previously employed with Atrium Health Carolina's Medical Center as the Injury and Violence Prevention Program Coordinator in the Pediatric Trauma Unit. She conducted bedside interventions with victims of violence and coordinated wraparound services to reduce risk and recidivism. It was in this position that Tracie recognized her passion for violence prevention, with over 20 years of combined experience working in the fields of public health and human services. She's worked in the area of child protective services, HIV, and sexually transmitted infections and substance abuse. She's a certified health education specialist, holds a Master of Science in Human Services, Bachelor of Science in Public Health, and is currently pursuing a doctorate of public health. So
real underachiever, that
one. Before I take the microphone over her, I will briefly introduce Dr. Clarkson. He's a nationally distinguished practitioner, researcher, and educator with a celebrated career in ophthalmology spanning more than 40 years. He currently serves as the executive director of the Ophthalmology Research Foundation and volunteers at the CPCC Eye Clinic, formerly the Lions Eye Clinic, in Charlotte for indigent patients seeking eye care. Dr. Clarkson is a volunteer with Meck with a particular interest in alleviating gun violence in our communities. That's why we have him here today, because we learned of him through Charlotte and Meck and it's just a wonderful conduit for information. So I'm going to turn it over to Tracie. You sure can.
I don't think I really need this microphone. Hello, everyone. Welcome, welcome. I'm glad you're here. I'm glad to be here. I hope you guys can hear me okay. And I'm going to try to stand so that I can do
it's just, you're
all of
perfect,
this
right? Where you
all
are.
right. And I'm going to put a timer on so that I don't run out of time.
And all you need to do to advance is just hit this little side.
Perfect.
But if you need help, I'm Kelly, just yell.
All right. Thank you. All right, so good afternoon. It is afternoon, right?
Yes.
It's been a long week. So good afternoon, happy Friday. I'm glad to be here again. As they said, I'm Tracie Campbell and I'm the Senior Health Manager for the Office of Violence Prevention with Mecklenburg County Public Health. So just to give you a brief overview of the Office of Violence Prevention, which you probably had no idea existed. So in the midst of COVID, almost 2 years ago, it'll be 2 years from next month, that this office came into existence. And basically, out of the rise of homicides and gun-related assaults that we've seen in Charlotte and Mecklenburg County, there was a lot of public outcry, right? People were saying, what are you gonna do? What is the government gonna do? And so we knew that one way to address violence was to address it as a public health issue. And so that's how this office was born. So I am a small but mighty office. We're getting more staff in soon. Our job really is to look at all the things that are happening in Mecklenburg County as it relates to reducing violence and probably trying to get all those things under one umbrella. So right now there are a lot of things happening, but it's happening in silos. And so that doesn't help anybody. So it's really like, how do we pull everything together? And if someone came to Mecklenburg County and said, what are you doing to address violence? They should be able to come to our office, and under that umbrella, we should be able to tell you all the things that are happening in this space. And so that is really what our office is designed to do. So the best way for us to do that was to actually develop a plan to address community violence. And so this is what you'll see here is this plan is called the Way Forward. It's a 5-year strategic plan, and it's specifically designed to address community violence. And so I'll talk a little bit about why that is, because most folks see violence and they'll say, oh, you should be addressing all these other things, but there are a lot of things that are already in place to address many forms of violence, but not so much so to address community violence. So this plan, again, is specifically to address community violence. If you ask yourself, what is community violence? You'll see the definition here. And we're really looking at violence that happens between individuals. Those individuals may or may not know one another, and it usually happens or takes place outside of the home. But some common examples of that could be assaults or fights between individuals or groups, shootings in public places, and crimes that are related to drugs or robbery. Those are some common examples of what we're talking about when we're saying community violence. So if you look at the two charts here, you'll see that on the top chart, we're looking at gun-related assaults in Charlotte. All the data that I'm going to talk about that you'll see is looking at data from 2015 to 2020. And so you'll see that we had this rise, this uptick in violence that's been pretty steady over the last 5 years. The bottom chart here looks at homicide counts and rates per 100,000, and that is specifically for all of Mecklenburg County. And again, you'll see this trend where we were actually still trending upward. Unfortunately, if we look at 2022, we are still trending upward. Nothing has changed. And so this is really how we're going to measure and address what's happening in Mecklenburg County. If you're familiar at all with the crescent and the wedge in Mecklenburg County, this map is exactly what we're talking about. So if you look at this map, the areas that are outlined and trimmed in the blue, these are going to be areas within the county and the city that have the lowest income. And we took that map and we overlaid that with the homicides, again, from 2015 to 2020. And you'll see that running east to west across Mecklenburg County and the city of Charlotte is where we see the highest counts of homicides, again, which overlays the lowest income areas. If you look at what we're going to consider the wedge down here at the bottom part here, and you'll see that there's some shading that's darker blue, those are going to be areas that have the highest income. And so we're looking at South Charlotte as being the wedge, more affluent South Charlotte. And you see that because of that, there's not as many homicides in this particular area. So if we looked at who's most impacted, we're going to be looking specifically here at homicides, looking at victims and suspects of homicides. And so you'll see the biggest trend is that between 18 to 34, that's where the bulk of the homicide suspects and victims lie between those age ranges. That's not uncommon to us. One of the things that is concerning, if you look at homicide suspects between the ages of 15 and 17, notice that there's a rise there. So what that tells us is it indicates that we need to be working with younger people, and we need to be moving in the trend to address violence from age ranges that are younger than what we're typically seeing. If we look at homicide suspects and victims in the same time frame by race, overwhelmingly 81.4% are going to be Black or African American. And so we know also that nearly 90% of those homicide victims and suspects were male. So who's most impacted in Mecklenburg, Charlotte, Mecklenburg? We're looking at young Black males.
And how does that coincide with the poverty as well?
It overlays. So we went back to that same map of that crescent and wedge map. You'll see that you could address anything. You could say COVID. You could say the food insecurity, food deserts, right? You could all the things, anything that you want to overlay that, any social determinant would fall in that same kind of category. The pattern doesn't change.
I'm sorry, I really meant specifically like out of the folks who are impacted by homicides. Does it correlate to poverty?
Yes,
levels? Okay.
absolutely,
Yeah.
absolutely. So we look at the how and the why. So we're looking at, again, homicide rates is what we're looking at here. We're thinking about the weapon of choice is overwhelmingly firearms, so 87.6%. If we look at the cause of homicides, the majority of homicides, we don't have an answer to. We don't know why they actually occurred. But what we do know is that overwhelmingly 27.6% are a result of arguments. So one of the things that we know we need to address is conflict resolution. How do we resolve conflict between individuals without resorting to pick up a firearm? And clearly we have a lot of firearms available in our area. So that is what we're looking at with the how and the why.
I'm sorry, I have two more questions.
Sure.
Because I don't want to leave this slide yet. So of the firearms, how many are legally obtained and how many are not?
I don't have that information available. I can get that to you. We do know what that is.
I was just
yeah.
curious. And then the second thing is, I'm surprised mental illness is not, I mean, I don't know if you can call that a cause. I mean, I think it's a cause, but mental illness isn't up there.
No, it's not really. That's not one of the things, because it's hard to determine. That would have to be if there's a diagnosis or there's not. And so there's so much mental health that's undiagnosed. It's very hard to determine, but I think that you could assess that, yes, there's some mental health within here. We know that that is a huge problem, but there's so much undiagnosed mental health. It's very hard to put a figure to that. No problem. Yeah, absolutely. So looking at levels of prevention. So we want to address violence from a primary, secondary, and tertiary level of prevention. And so we really want to work upstream, and upstream would cause us to look at violence prevention from primary perspective. So we want to look at making sure that we have more youth development programs, that we're supporting youth and families, that there are mentorship programs, all of those things that are working with people before they actually get involved in violent acts. Our secondary prevention is looking at like our violence interruption programs or our hospital-based violence intervention programs. Those are working with people that are in the thick of violence, right? So how do we stop them while they're right in the thick of being involved? And then our tertiary prevention is really looking at restorative practices. How do we help people who have had a violent incident occur, who have had previous criminal justice involvement? How do we work with those folks so that we can stop that cycle of recidivism and they don't go back to the things that they were doing? You'll notice in this plan, as we walk through the plan, that you will see that we've addressed violence in all three of those areas of prevention. So what's our approach? We're using the public health approach. We know that if we address violence as a public health issue, as a disease, then we can, we have strategies in place that we can really address violence and see some reduction. So with our plan, we engage with more than 400 residents within Mecklenburg County. If the plan says it's a community violence strategic plan, community is really important part of that. So we wanted to make sure that we assess what people felt like were the perceptions of violence in Mecklenburg County. What were the root causes? What were we doing well? What were areas where we needed to improve? And so we did that through focus groups and interviews and online surveys with individuals. So the last thing we did was we partnered with UNC Charlotte to analyze that data. When we analyzed the data that we got from all that community engagement, we were able to come up with 5 areas of focus, and under those, doing a deeper dive, 21 strategies. And so I'm gonna quickly kind of walk you through those. Oh, I got plenty of time. Not plenty of time, but I can talk all day, so I have to really watch myself. And so I'll say that these goals you'll see on the screen, this is what we're looking for long-term goals in terms of this plan. This is a lofty goal. This is very aspirational. We have to push the limits to say, what do we want to see? And what we want to see is a decrease in homicides and gun-related assaults, both by 10% over the course of the next 5 years. And so this is based on baseline data from 2022, and it's looking at rates. So we're going to make sure that we're accounting for the influx of people that might be moving to Mecklenburg County over the course of the next 5 years. So these are the 5 areas of focus. So what we're looking at is area focus 1 is community engagement and partnerships. What we're looking at here is making sure.
1 second.
Can get out.
No. It's. I think our battery's made it.
Well, I talk really loud, so if it does.
It's a focus on 9.
Oh, can they not hear me?
1 second.
Okay.
Unless you don't plug it, you think it would.
Change them when I got here.
Yeah.
We heard you. You better be kidding.
You might have actually put in batteries that weren't quite charged yet.
No, they were all charged.
Just kidding.
Yeah.
It's like I had a solution there.
Right, we can do like the. If we're speaking about the 70s, like that was like, back into the 80s.
Yeah.
All right, we good? All right.
Excellent. Okay, so we're back on. So community engagement and partnership. This is focus area 1. Really looking at how do we make sure that public and private stakeholders all have equal buy-in to this plan, and that we're hearing the voices of people, that people are working together, that we're addressing policies, programs, and procedures to reduce violence over time. The next area of focus is going to be support for youth and families. And so here we've heard overwhelmingly in our community engagement that we do a really great job of working with youth, or we do a really great job of working with adults, but we do not do a great job of working with the family unit as a whole. And so you'll see that as we work through this area of focus, that there are strategies that are inclusive of the entire family. So economic opportunity, I think it goes without saying that if we're thinking about violence, that we need to be opportunities for economic growth and for people to have living wages. So there you'll see a lot of work there. Intergovernmental collaboration. This is also interagency collaboration. So we're looking at making sure that our government agencies, our elected bodies are working together, and that they're not working against one another, that they're working in tandem, moving in the same direction. We don't want to be duplicit in the efforts that we're doing to reduce violence. So we're working on making sure that we are on the same page, moving in the same direction. Safer and healthier neighborhoods. So what we're looking at here is making sure that despite what zip code you live in Mecklenburg County, that you feel like you can live, work, play, worship, go to school and learn in a safe environment. And so that's really important for people overall. So I'm going to walk you through briefly. I'm not going to talk about every one of these strategies, but I'll give you kind of the overview. It's a lot. Okay, so just buckle up. All right. That's a whole lot. Yeah, a whole lot. So really here in community partnerships, community engagement and partnerships, again, making sure that there's shared decision-making power between community and agency and government. We want to make sure that community members know that they have a seat at the table. Their name is already there, that they don't need to be invited. They have a place at the table, and we want to make sure that we hear their voice from the time that we put this plan together, through implementation, through evaluation, and tweaking the plan as we go along. So again, it's going to be ongoing community feedback that we're going to have. The cornerstone of my office is community engagement. So there will not ever be a time that you all invite us to come out and that we'll be like, no, we're never going to come. We're showing up, right? So we want to make sure that we hear from residents and that we adjust this plan. This is a living, breathing document. So over the course of the next 5 years, we know that what is important to people today may not be as important to them in 2 years or in 4 years. And so we want to have the flexibility to adjust this plan to meet the needs of the residents of Mecklenburg County as we go through. So we're going to be launching a multimedia awareness campaign. So you'll see stuff that's on CATS buses, on the light rail, hopefully at gas stations when you're paying for gas and you're getting $30 worth of gas and you don't have anything else to look at but read all the signs that are right around here. So you'll hopefully see something like that. There'll be a lot of messages going through. We really want to make sure that over the course of this next couple of years that people constantly have violence prevention messages in front of them all the time.
Are you guys having to pay for that, or
Oh yeah,
are they?
Yeah. Oh yeah. That's a short answer to that. Absolutely. But you'll see that there are some things in here that will hopefully offset some of that as we go through. I'll talk about what that might be. So we're looking at making sure that we have performance-based funding. What typically happens across the county and across the country is that, you know, government agencies in particular, we fund lots of people for lots of things. We want to make sure that we're funding the right people that are doing work that we know is making a difference. And rewarding those people to help scale up their programming that are doing evidence-based practices or best practices to reduce violence. We're also going to be starting a Peacekeepers Academy, which is going to be a community of learning, an interactive learning series for community-based organizations that are working in this space to reduce violence. We're going to be helping them to build organizational resiliency and beef up their infrastructure so they can continue to do work in the community. We're looking to subsidize infrastructure for safe communal spaces. So what that means is that for instance, the county is developing these community resource centers, these CRCs across Mecklenburg County. One of them is Valerie C. Woodard on Freedom Drive. And so we want to make sure that folks have opportunities to utilize that space in the community. We heard overwhelmingly from a lot of community-based organizations that they don't have space to operate within the communities where they want to serve people. So they're taking their product every time, they're picking it up and they're moving it from place to place, trying to find places to operate. And we want to make that available to them. So support for youth and families. We're looking to adopt a universal screening and referral process for individuals and families that have been impacted by trauma related to violence. And so one of the things that we know is that we have a lot of things in place and we work with victim families very well. For a prime example, say you are in your neighborhood, there's a drive-by shooting in your neighborhood, bullets do not fly through your house, but they fly through your neighbor's house. We have tons of programs that are going to go out to your neighbor's house and address them and work with them, but nobody works with your family who is also impacted by the trauma of gunshots in your neighborhood. And so we're looking to help make sure we're addressing everyone in the community. So we're looking to, and this goes without saying, goes back to this comment here, behavioral health and mental health services, specifically for individuals that have been impacted by violence or exposed to violence. We know we need to expand access to that. Community-based youth mentorship and parenting education programs. Again, this is where we're working upstream in that primary prevention realm. So economic opportunities. One of the things we're going to be doing is working to beef up the number of or increase the number of second chance employers we have. We know that we hear a lot from residents who are returning after having involvement with the criminal justice system that they can't find a job. And anyone that can't find a job, what do? You resort back to the things you did prior to. And so we need to make sure that we have opportunities for people to have living wages and take care of themselves and their families. We want to expand financial literacy education programs, particularly for residents that live in areas that are impacted by violence. And we also want to make sure that we are implementing a comprehensive workforce development plan that's really going to work on disconnected youth or focus on disconnected youth and other individuals that are at higher risk. So again, this plan is not everything for everyone, and we know that it's not comprehensive, but it's designed to work for the people that need it the most. And those are often folks that we have disinvested in over time. So when we look at interagency government, interagency collaboration, we want to make sure again that our elected bodies are working together. This is one of the things that we talk about. Are we paying for things? 4.2, and I'm really excited about this, is that we want to make sure that we're fostering partnerships with private businesses and philanthropic organizations. We want to see organizations and businesses that are coming to bringing their headquarters to Mecklenburg County invest in the community here in Mecklenburg County. And so we want to see them co-invest in violence prevention initiatives. If you're going to bring your company here and you're going to make money off of the people in Mecklenburg County, then it is your responsibility as a partner and a member of our neighborhood and our community to help the people that are here. So we're hoping that we'll see more investments in that. And you'll see it's a lofty $3 million worth of investments that we're hoping to get from those co-investments over the course of 5 years. Yeah.
What, I'm sorry, but will the county commission use that as any kind of incentive-based way to get companies to come here?
If you ask me, that would be my goal. Now, I can't speak for the county commissioners.
Yeah.
So that would be something that we hope that as the county is adopting this plan and other agencies are adopting this plan, that they'll say, yes, this is something we would like to kind of write into as a policy or practice that we'd like people to do. So that is where this comes in with a lot of encouragement for folks. So again, as we are sharing plans like this, and you may sit with a county commissioner somewhere, and somebody happens to be your friend, that you say, you remember I talked to the lady and she said that this, and why don't we put this and make this a practice, right? So again, this goes back to how do we change policies and practices, and that's a practice, because that's an easy thing to do, is to encourage people to do that. So lastly here, we want to establish an interagency response plan. So we want to make sure that all the systems that are working with folks when there is a violent incident are working together, that they're talking to one another, and they're making sure that they are working together to help families as a whole. A prime example is that sometimes the school system, if something happens in the summer with a family, the school may not ever know that there was a family that had an incident that happened over the summer, because there's no system in place to talk to one another. But those kids may be struggling as they come back to school because they have had a violent incident occur and no one knows about it. So that's one of the ways that we want to address some of those things. And lastly, here we're looking at how do we make sure that we are continuing to have people in our data collaborative, which is a shared data system that helps us look at, helps us track and monitor what's happening in Mecklenburg County in terms of violence, and it helps us to inform what our practices and prevention efforts might need to be. And we're also going to be implementing a 100 Youth Advisory Council. So that is how we're going to get youth voice into this space. So there will be 3 branches of that. There'll be a middle school branch, a high school branch, and then a branch of 18 to 24-year-olds. And collectively, they will form the 100 Youth Advisory Council, but they will operate independently. And this is the last area of focus. I got 3 minutes. There's a last area of focus, and so support for this is whatever it's called, neighborhood, safer neighborhoods. Safer and healthier neighborhoods. I was like, that's covered up. I can't even remember what this is called. So we want to make sure that we are supporting the expansion and implementation of more of our community violence interruption programs. So if you're familiar with, the county and city came together to fund our Alternatives to Violence program, which is our violence interruption program that uses the pure violence model and operates out of the Bates Ford and LaSalle corridor. We'll be expanding those to 2 other neighborhoods within Mecklenburg County. We want to again support the expansion of our hospital-based violence intervention program that Atrium has as well. And so we're looking at working with the city of Charlotte, making sure that we are expanding opportunities for funding and support for our corridors of opportunity and our Safe Charlotte grant. We want to make sure we have opportunities to expand that outside of the city of Charlotte to encompass more areas within Mecklenburg County. And then lastly, this is super important, is that, again, for safe physical spaces, we want to make sure that there's adequate trash pickup, that code enforcement is taking place, that we don't have a lot of vacant buildings and things sitting around, that people have adequate lighting in their neighborhoods. Those are things that we know deter violence and crime from happening. And so those are easy fixes for us. So lastly, what can you do? You can learn more about the plan, you can participate, and you can advocate. Some of the things that we're asking community partners and neighborhoods to do are to provide feedback on this plan. So I will be providing this slide deck to everyone here, along with a way that you can provide us some feedback when you have a chance to maybe take a deeper dive and look at this as a whole and kind of digest, because this is a lot. You can join the implementation team. So if you work for an agency or partner with some type of organization and you see that there is a space for you guys within this plan to form an internal implementation team or join that with another agency, we're asking that people volunteer. We have a regional coalition that's called our CVPC, and that's our Carolina Violence so many acronyms. Carolina Violence Prevention Collaborative. I cannot keep up. So CVPC, and so this is a group of community-based organizations that we've partnered with, and we have this coalition. They're doing work in this space. These are the people. These are the boots on the ground. These are the people that we need folks to support. I am a small office. It is not my job to do all of this. Right? We are dependent a lot on our community-based organizations because they do work with community members. And so we're asking folks to support those organizations or to figure out how you can volunteer with those. So we'll have access to that list for people and to share this plan and the way forward. So the last thing I'll say, and I have 52 seconds, I am good. And so the way forward is together. So when we thought about the name of this plan, this is what we knew. We knew that we were doing a lot of work in this space, but one, people don't know what we're doing. It wasn't happening under one collective voice and moving in the same direction. And it hasn't been working, right? It hasn't been working. So we know that the way forward to reduce violence is working together. So here we go. This is the way forward. I will email the slide deck out to you guys. And on that, there will also be a link for you to provide us with feedback. You can also at any time email me. That goes to a general email for me, but you guys probably have my email address and contact information. If there's something you want to say, like you hate the plan, don't say that. So don't email me that, but if you just like, if you love it, or you're like, why did you guys think about this? This again is not comprehensive. Perfect. This is not comprehensive, right? It doesn't include everything, but it's a start, and it's a way for us to move forward and to measure what that looks like. So I will stop there because I'm at 25 minutes.
Before I do want to give you all some time for Q&A, but I want to get Dr. Clarkson up here as well too. So Tracy, can you stick around maybe after the meeting too?
Yeah, absolutely.
Dr. Clarkson is going to talk a little bit. There's a lot that connects Rotary to what she just said. A lot. When we think about peace and conflict resolution, when we think about our kids, our youth activities, SFTL, there's a lot that connects us. So one of the things that we wanted to do is to have Dr. Clarkson, who volunteered with Meck to talk about things, particular actions that we can take as individuals to help stem violence.
Thanks, Kevin. Do you mind passing out?
Oh, yeah, absolutely.
Might ask how does an ophthalmologist get involved in gun safety? By the way, Kevin didn't mention it, but I was on the faculty at the University of Miami in Florida for 40 years. We moved to Charlotte. Our grandchildren are all here. Joined Myers Park United Methodist Church. And following the Charleston Mother Emanuel massacre, I got involved with several people at our church in addressing race relations. And one of the things we did was partner with Otto Harris at St. Mark's United Methodist Church, which is a predominantly Black church. And Otto conceived of a program that he called Pass the Peace. It brought together white youth, Black youth, white adults, Black adults with the police. And what we did was organize meals, which we subsidized, and had 2 of each one of those come together for a meal at various restaurants in the Charlotte area. The whole purpose was to enhance communication. And we met with the chief of police. They were very cooperative in doing this. Bring this up because one of the things, and Tracie, gun violence was only one of the things that her group is addressing. We met at the Stratford Richardson YMCA with the police and youth. And one of the things that astounded me was that the youth told us at that meeting, and one of the things we were talking about was conflict resolution. Instead of fighting, actually discussing what the issues are and trying to reach a resolution. What we learned at that function was that those young men predominantly said they could have a gun within 10 minutes. They could go out of that YMCA and come back with a gun in 10 minutes. Now, I don't know whether you heard about what happened in Raleigh. This is a 15-year-old. And this was adjacent to a golf course who killed at least 5 people. There were 5 dead, others were seriously injured. How did that, we don't know anything about the young man yet, but how did a 15-year-old come up with a gun and do this? And you didn't say.
He had a long gun in the hand.
Oh, he did,
Yes.
because, and Tracie, you didn't say, I think most gun violence is with handguns, although a lot of the mass shootings are with long guns. Fast forward, after Buffalo and Uvalde, some of those who were in the race group said to our senior pastor, James Howell, you know, the time for thoughts and prayers is well past. And as John Lewis said so well, pray continuously, but keep your feet moving. Do something. So James reached out to his colleagues across the religious community. And we brought together, we invited people to come to talk about developing a process to improve gun safety. It's not about taking guns away. It's about trying to make our communities safer. Churches, shopping centers. Now, this was adjacent to a golf course, synagogues, the Sikh community. I can't think of an organization that hasn't been impacted by mass shootings. I sing in the choir at our church. I can remember not long after this happened, we're sitting ducks up there, and there's only 2 doors out. What if somebody came into the back of our church with a gun? I never, ever in my life thought about stuff like that. But we have to today. So James invited a number of people. They came together. We had people from the Jewish faith, from the Catholic faith, Protestantism, the Sikh community, and community business members who began to meet. What we developed after a couple of meetings, you have in front of you. It's sort of a statement of purpose. And then we developed an online petition that has 8 specific recommendations. We have about 1,600 signatures to date, and that's not going to get anything done. But our goal is to educate folks to the fact that we need our elected representatives, local, state, and federal, to own up to the fact that gun safety is in everyone's best interest. Not taking away guns. This has got nothing to do with the Second Amendment. But it does have to do with how does a 15-year-old get a hold of a gun? Why can you get a gun when you're 18, but you have to be 21 to drink an alcoholic beverage? So there are a number of things on there. You've heard about red flag laws. You've heard about a mandatory background check, 3-day waiting period, things such as that. So our goal, again, is to, and this is started with the religious community, but obviously this is a problem for all of us. So our hope is to be a small part of what Tracie and her folks are recommending. But this is specifically for gun safety. Gun safety. If you have you have to pass a driving test to drive a car. You don't have to have training. I think responsible parents train their kids in gun safety. But the young people at Stratford Richardson, they're not worried about that. If they got a score to settle, they want to go out and find a gun. I'm not saying they did, but that's a mindset. So anyway, I hope you'll read this. If you are inclined to try to want to support it, I hope you'll go. At the bottom, there's a link to the petition. I hope you'll sign it. One of the things we've learned in this process, we've met with local and state politicians. It is uniform among politicians privately that improved gun safety is in everyone's best interest. But, and this should not be partisan, but it is. And there's at least one set of people who, even though they think this way, are scared to death to say anything publicly. We need all of them to recognize that we need to live in a safer world where we're not concerned about gun violence when we go to the malls, when we go to a concert, when we go to church. Thanks.
If you all want to have questions for anyone here, when Chalu talked to us about this originally, it was with the request that as an organization, Rotary embrace the petition. But we can't do that just for the reasons that Dr. Carson said. It's considered political, even though for me, it's all about common sense. So you can sign these things as individuals. I signed it because I feel very strongly about it. I would encourage you to review what Dr. Clarkson has said, and if you have any questions for either of them, please, this is the time to do it. I know we're a little bit over, but if you have any questions.
And Kevin, let me say, we have a number of different churches that are supporting this. But most of them don't want to even submit it to a vote. So you're absolutely right. We're not interested in creating controversy. We're interested in identifying people who with whom this resonates, so that we can, at some point, get our elected officials to take meaningful steps. Not what they did this past year. That was enough to say we've done it. We're not going to do it anymore. That doesn't really address the problem.
And you mean on the federal level or?
Yes, federal level.
So Tracie said she will be available for questions after the meeting.
Yes,
Clarkson will also be available for questions after the meeting.
No questions deadline.
On behalf of our club, I'd like to present each of you with our Rotary 4-way test coin, with our sincere appreciation for your presence here today.
It doesn't work in the arcade, so.
We need, Tracie, can you, I want you to come up here and spin this. Just pick out one ticket and read off the last 3 numbers.
Okay, we did the glasses off so I can see. The last 3 numbers would be 192. Lucky 192.
Thank you so much. These were very interesting. And these will be shared in the newsletter as soon as I can get it together. Pass up your current buckets and please stand and we'll do the fireworks. Of all the things we think, say, or do, number 1. Number Number 2,
Fair for all concerned.
number 3,
Will it build goodwill and better friendships?
number 4,
Will it be beneficial to all concerned?
and number 5. Thank you all for attending. It was wonderful. See so many of you.
What?